So today I wanted to discuss with you a case where a patient came into the office and they are missing a tooth. It's what we call tooth number 19, which is a lower left molar. They had it pulled a while ago, and we had a video on this before where what happens is when you don't replace a tooth right away, the other teeth will start to shift. You can see this is a reconstruction of the patient's lower jaw, and you can see they're missing a tooth right in this area. And this tooth right behind it has shifted forward. So what will happen is that we need to place an implant here. Not the greatest as far as when we design a crown, we have to keep this in mind, is that it's not going to have the greatest contact. But we need to make a surgical guide to have a precision placement of the implant. So what we're going to do is as follows. We are going to plan this case together on this video so that you can see how we plan surgical guides to make sure that our implants are placed very precisely in exactly the position and depth that we want it to be. What we have is this yellow line, which is a nerve that travels in everybody's lower jaw. That nerve gives feeling to your cheek, chin, lip, tongue, and teeth on either side of your face, so we want to make sure that we are clear of that nerve. And you can see I already placed my implant in the position that I want. Now, how do I know that's the position that I want? Because I went ahead and placed the tooth there, a fake tooth. So I know exactly where I want my tooth, and I want my implant to be lined up with my tooth, as you can see here. So we are very precise in our placement of our implants because we plan these cases prior to actually doing surgery. Now from here, what we're able to do is create a guide. Now this guide has a little tube inside of it, which allows us to drill right through there, and our drill fits perfectly and does not move to the right, does not move to the left, and it stops at the depth that we want, so that our implant right here is placed perfectly in the position that we planned prior to the patient's surgery. We sent the file over to the 3D printer, which is right over here for that surgical guide, and it is currently printing right now. It'll be ready in about 15-20 minutes. We will put it in the patient's mouth and then perform surgery, and we can show you the post-op after we're done. If you're looking for an implant, make sure that it's done precisely, make sure that it's pre-planned and not just done on the day of surgery with some guesswork. So if you're looking for something like that, you can definitely find all this technology and precision implant surgery at Long Island Implant and Cosmetic Dentistry. Thank you.